I just realized I'm muted and I just gave a whole spiel on mute. We're gonna go ahead and get started. So just a reminder to everyone to please mute yourselves. If you're on a cell phone, you can mute yourselves by pressing *6 or pressing the mute button on your actual handset. There will be an opportunity to ask questions, but I do ask that you write down your questions and wait till the end. Justice's presentations are very, very robust, and there's lots of information you're gonna get, and there is a very high chance that he will answer your question before you even get to it. So just write down your questions as they come. You may get the answer, and then at the end there will be an opportunity for questions. So again, if you're on a phone, please mute yourself so I don't have to manually mute you. And we will go ahead and get started. Thank you.
Okay, and Gemma, could you enable screen sharing? Although I don't think I'll use it until.
Access, I don't have it blocked.
Okay, let me try it now.
Yeah.
It says host disabled participant screen share.
Okay, try now.
Okay, now I got it. Great. Okay, I'm not going to turn it on until the end here. So we're ready to start. Are we ready to start, Gemma?
Yep.
Okay, great. Let me introduce myself again. My name is Jess Joseph. I'm a patient advocate and licensed health insurance consultant, licensed by the state of New York. And this is the 9th year in a row that one way or another, I've been doing some kind of workshop during Medicare's open enrollment period to help people decide whether they should change their Medicare plans. And I also, I think those are, the main qualifications. So the first thing I want to emphasize is that when people talk about Medicare, they say it's complicated and confusing, and all those things are true. And my experience, including my own experience, is that no one really gets it the first time around. And so usually what I'm going to do is run through the basics briefly and really try to provide you with a framework for knowing what's important and what's possible. So try not to be anxious. And I want to give you a web address now. So if you get a chance to get on the internet, you can get all the information you need. And I'll show you the page at the end. It's a Zoom page, but the address is Medicare212.com. Easy to remember, Medicare, all small letters, and then the New York area code 212.com. And if you go to that web page, you'll see a little menu near the top, and if you click on that, you will see something that says Get Help. And if you click on that page, you will see information where you can get information on the web. You can get information about New York State Medigap that's hard to find. And you'll also see something that says Get Help over the phone. And so that's very important. But you can get free help over the phone, including choosing a Medicare Advantage plan, or if you're an original Medicare, a Part D prescription drug plan. And at that page, you'll see you can call 1-800-MEDICARE. You can call the Medicare Rights Center National Helpline, the phone number's there. And then you can also call HICAP, which is the agency every state in the country has to assist people in enrolling and selecting plans in Medicare. And those programs are person to person. And I'm also not going to cover any of the income qualified programs like Medicare Savings, EPIC, so on and so forth. when you go to that page, you'll find there's lots of well-written, accurate, trustworthy information and facts about Medicare online. What's really hard to find is what I'm presenting you with today is a strategy about how to get the most for your money. I like to say that just because you know the rules of chess or baseball doesn't mean you know how to win at chess or baseball. And so what I'm going to try to do today is, instead of explaining and explaining, and yes, can I write the web address? I can, but I'm not sure I know how to do that. So let me continue, and I'll see if we can come to that later on. Maybe Gemma can write it. So what I've done in the class is to explain how all the parts of Medicare work. And then you have all these choices you make. You have original Medicare, you have 50 different Medicare Advantage plans, you have 19 prescription drug plans, you have 12 different kinds of Medicare supplements available from 7 different companies, and people get overwhelmed and paralyzed. And half the people I deal with individually just throw up their arms and say, well, would you just tell me what to do? And I say, well, the problem with that is I don't know, I have to know your individual situation. And you know, that would take a lot of time to make sure I'm giving you the right information. But I think there's a way around that. And it's comparable to what happens when you go out and you buy a TV, and you get the TV, and they're what are called default settings. It's set to Dolby stereo or regular stereo. You know, the picture colors are all preset. And so I'm going to recommend the Medicare plan that I think would be the best for most people most of the time. And by that, I mean, it might be best for 40% of the people, but the next best plan might just be work for 20% of the people. So we're going to use that as our default, and then we'll see how it is that we might vary from it. So the first thing to say is my default Medicare plan would be using original Medicare. Some people aren't sure whether they have original Medicare or what's called Medicare Advantage. The easiest way to tell is by looking at how you pay when you go to see the doctor. If you go to see the doctor and you show them a plastic insurance card and you pay a copay in advance, like $10 or $20, and then you see the doctor, and you use that same card that you used in the doctor's office to pick up your prescription drugs at the pharmacy, then it's 99% sure you have a Medicare Advantage plan. If you had original Medicare, you don't pay anything in advance and you get billed later, and the card you show at the doctor's office won't help you get your prescription drugs at the pharmacy. You would have a separate prescription drug card. So just in case you're not sure which plan you have, that should tell you, you know, whether you have it or not. So the question is, why am I recommending for most people most of the time original Medicare as opposed to Medicare Advantage? And let me say, I think most of us know the advantages of Medicare Advantage, because once you're enrolled in Medicare, you get tons of advertising. For no extra premiums, you might be able to get a prescription drug plan thrown in, free vision care, free dental care, free hearing care. All of these might be very limited, but they're giving you things for free. That's kind of marketing. And the way Medicare Advantage works is Medicare figures out how much it costs to take care of the average patient in original Medicare. And then they take that average and they say to United Healthcare or Blue Cross Blue Shield. If you want, we will give you that amount of money for every patient, and then you have to take care of it. And what the Medicare Advantage plan says, that's great. And we think we can do a better job than you guys because we're not going to approve unnecessary treatments and tests. And we're going to call our patients and we're going to make them healthy. And we'll save so much money that we'll be able to give all these free benefits. And as a private company, have enough left over to make a profit. And if that sounds familiar, it's the basic concept of the HMO. So that's an explanation of how it is that they think they can afford to give you these extra benefits. Now, since you might, be interested in all those free things, why would you choose, or why would I recommend Original Medicare? So the basic reason is that it gives you better access to medical care. And it's interesting, when we get all this advertising, we're approached as consumers. You get this free, you get that free, so on and so forth. And when we actually need to use this insurance, though, and we're really sick, then we have to deal with it as patients. And so my philosophy is, if you're healthy, all these benefits are great, but I want to insure for the worst possible case, which would be a case in which I'm really sick. And if I'm really sick, I want to have access to the most doctors and hospitals possible. And Original Healthcare gives you that. Here's the reason why. For someone to be for a doctor or a hospital to take United Healthcare or Blue Cross, they have to join that plan's network. And in order to join that plan's network, they must first have had to enroll in Original Medicare. So everyone who is in an Advantage Plan network also takes Original Medicare patients. But there are quite a few doctors who accept Original Medicare, but they don't accept Medicare Advantage. Most notably in New York, Memorial Sloan Kettering Cancer Center accepts Original Medicare, but they don't accept Medicare Advantage. One big reason for that is Original Medicare is the largest funder of residency training programs in the country. So all the teaching hospitals, any hospital that has residents, is almost surely going to accept Original Medicare, as is almost any other hospital. The second advantage is that you can use Original Medicare anywhere in the country. Let's say you are diagnosed with a condition and the doctor says, we've got someone here who can help you, but let me tell you, the people who really know how to treat this condition are at the Mayo Clinic in Rochester, Minnesota, or Johns Hopkins in Baltimore. If you're in a Medicare Advantage plan, that provider is going to be out of network. And I'm not going to get into the PPOs, but let's just keep it simple. So you can't use your insurance there. If you're in Original Medicare, you use your insurance at Mayo Clinic, Johns Hopkins, just like you would use it at Mount Sinai. And so, this is what's really important. And this is the advantage of having Original Medicare. There are a couple of other advantages, however, that do have to do with saving money. The first is what we call out-of-pocket maximums. Now, what's an out-of-pocket maximum or an out-of-pocket cap? Okay, so here's the way Medicare Advantage and Original Medicare work. Every time you get a service from a doctor or a hospital, Medicare or your Medicare Advantage plan pays something to the doctor, and then you have something you have to pay. And that part that you have to pay is called your out-of-pocket. That's what you're writing the check for. And the Affordable Care Act, the Obamacare law, says that any commercial insurance company must have an out-of-pocket cap of at least $7,500, which means if during the course of the year, under my insurance, Medicare Advantage, I end up paying the doctors and the hospitals up to $7,500. After that, the insurance company has to pay the rest of it, and I don't have to pay anything. Now, Original Medicare does not have an out-of-pocket cap. So potentially, theoretically, sky's the limit, although Medicare costs are low enough so that you're not going to run those costs up too high. However, if you have Original Medicare, you can buy a Medicare supplement. And this is the linchpin and the pivot of the whole thing. And I'm going to show you how that works, where it would bring your out-of-pocket expense down to $3,200, not $7,500. This is why the studies they've done on why patients switch out of Medicare Advantage into Original Medicare, the most often stated reason is the patient had a serious illness. So they wanted that access to more hospitals and providers, and also they wanted to lower their expenses. The other area that's not so obvious is every Medicare Advantage has a built-in drug plan, and that's what you get. You don't have any choice. If you're on Original Medicare, in New York City this year, you can choose from 19 different drug plans. And what you would do is use the Medicare.gov site, and you would enter in all the prescription drugs you take, and then the Medicare computer would tell you what the cheapest plan is. And by having a choice of plans, it's not uncommon for people to be able to save $500 or $1,000 or more a year just on prescription drugs. This is what you want to be aware of. Is why is Original Medicare good? It's because access to more providers. It's because you could have a chance to lower your out-of-pocket expenses, and you have a chance to save money by selecting from 19 different drug plans. Okay. So the next thing I would recommend as part of this default plan is that you get a Medicare supplement or a Medigap plan. And the plan I'm going to recommend is called High Deductible Plan F, or if you're younger, High Deductible Plan G. There's essentially no difference between them. Now, let me explain how Medicare supplements work, because it's a weird concept we don't encounter anywhere else. When you have a Medicare Advantage plan, or if you look at the group insurance you were on from your employer, you go to the doctor, you go to the hospital, and you have to pay a certain amount of money, and that's it. There is no such thing as a supplement or a Medigap plan in the world of Medicare Advantage or regular insurance in this country. If you have Original Medicare, though, what you can do is buy one of these plans, and it does not get anything covered that is not already covered under Original Medicare. You will see ads from AARP, United Healthcare, that say, when you join our plan, you can see any doctor anywhere in the country. You don't need to have a referral. That all those things are true, but you already had them by virtue of having Original Medicare. And so that does tend to confuse the issue somewhere. And I just want to say here something about AARP that you want to be aware of. When you see an AARP United Healthcare plan, what is happening, and AARP tells you this in every ad they do in the fine print. AARP is licensing its name out to United Healthcare. And they're saying, we think United Healthcare meets our standards for insurance. They're not saying it's better than Blue Cross or Aetna or any of the other plans. They're not even saying it's good. They're just saying it meets their standards. And it's somewhat shocking to think that AARP gets paid for letting United Healthcare use their name. I'm not sure exactly how much, but I know from their financial statements, which are public, that AARP gets $750 million, $750 million a year in healthcare royalties. I would guesstimate that 80% of that comes from United Healthcare, or $600 million. That accounts for 34% of their revenue, and it's double the amount of money that they get in dues from their members. So they have a conflict of interest there in how they have a conflict of interest were they to ever do anything that would affect how United Healthcare made money. And let me give you an example. One of the things that Medicare Advantage plans do is they are entitled to use prior authorization. This is one big reason people go into Original Medicare, because Original Medicare doesn't have prior authorization. That means if you're going to have an expensive test or elective surgery, maybe transition from a hospital to a rehab facility, before you can be covered, your doctor has to get authorization from your Medicare Advantage plan. And that can cause delays. You might even be denied. Doctors hate it. If you're really sick and anxious, it's a real burden. Original Medicare doesn't have that. If your doctor says you need an MRI, then that's it. Medicare will pay for the MRI if they think it's medically necessary. Let's say you need a second opinion. At a certain point, your Advantage plan might say, well, we only can pay for 2 or 3 second opinions. With Original Medicare, you can go to as many different specialists you want to make sure that you're getting the best advice. And second opinions, and you know this from when we used to do workshops at the Isaac Center with Dr. Paul Brown, the most important tool you have in your toolbox as a patient is the second opinion. Anything that has serious side effects, or perhaps serious expense for you, or real risks like surgery, you should always get a second opinion, and even a third or a fourth. I'll tell you something, you don't want below average doctors and hospitals, right? Well, by definition, half the doctors and hospitals are below average. So that's an important reason to have Original Healthcare. And the problem is, for the Medicare Advantage companies, one way you make more profits for your shareholders is to pay fewer claims. Hopefully, they're turning claims down and authorizing denials of procedures based on their merits, but the incentive and the temptation to use that tool to make money remains. So, circling back from AARP and prior authorization to what a Medicare supplement does, it does not cover any condition that's not covered under Original Medicare. all it does is pay your share. The deductible you might pay if you're admitted to the hospital is $1,400. It may pay all or part of that, and it would pay your 20% coinsurance. Now, I've said that I recommend high deductible Plan F. Here's how Plan F works, and this is the most popular plan that people have in New York City. You go to the doctor, you show them your paper Medicare card, and if you don't have a supplement, they take that card, they file a claim to Medicare with your Medicare number on it. Medicare pays the doctor 80% of what's authorized for the procedure. And then they tell you you're liable to be billed the other 20% by the doctor, and the doctor bills you. If you had what's called Plan F or Plan G for all practical purposes, you go to the doctor, they treat you, they send in the claim to Medicare, and in addition to putting your Medicare number on that claim, they put the Medicare supplement number on the claim. With Plan F, the claim goes to Medicare, they send a check to your doctor, but then they forward the claim to your Medicare supplement, and the supplement pays your doctor the 20%. And it does that without any deductible unless you're, say, under age 67, in which case there would be a $200 deductible. But that's what they do. And so no matter what happens to you, you never see a bill from a hospital or a doctor, but you do pay premiums. And rounding down, the premium is $300 a month for the cheapest plans, or $3,600 a year. So when I see a person who has Medicare Advantage, I often hear, I understand why original Medicare is good, but I'm told you have to have a Medicare supplement, and I don't have $300 a month to spend. And the real purpose of why I come to the Isaac Center and every place else is, if original Medicare gives you the best access to healthcare, then I would like to see everyone be able to afford it. So I tell them about what's called high deductible Plan F. It works exactly like Plan F does. It pays everything that can be possibly covered by a Medicare supplement. However, there is a deductible of $2,300. Let me just go to actually $2,370. So this is like the out-of-pocket cap we talked about, that was $7,500 for Medicare Advantage. You get a bill from the doctor for $20, you've got to keep paying those bills until everything you have paid reaches $2,300, and then your Medicare supplement pays the rest. Now, here's the thing. If you had out-of-pocket expenses all the way up to that deductible of $2,300, you would still pay less in total when you include the premiums than you would pay under regular Plan F. But let's say you were healthy and you had $1,000 in expenses, or let's say $500 is more like it. You would have to pay the $500 to the doctor, and then you would have to pay the $840 in annual premiums to the doctor. Your total cost would be $1,340. So this is what we look at, total cost. But let me go a step further, and here's what most people don't realize that's unfortunate. Let's say you choose the option, well, I won't have a Medigap plan at all. Well, most people, especially between ages 65 and 75, would actually save the most money by not having any Medigap plan. But most of us would worry about that. So here's what you could do in New York State, but not in most of the other states, not in 46 of the other states. Here's what you could do. In New York State, you can buy a Medigap plan any day of the year, see it 365 days a year. In most states, you are only entitled to buy a Medigap plan without, you're only guaranteed the right to buy a Medigap plan within 8 months after you first join Medicare. After that, you know, if you're 68, 69, whatever your age is, if you want to buy a plan, they have the right to make you take a medical examination and actually refuse you insurance. So most people feel like they're forced into it, and they are forced into it. But in New York, you are guaranteed the right to buy a Medigap plan any day of the year, and you pay exactly the same for it as someone who has been on Medigap all their life. So let's say you have no Medicare supplement and you get a terrible diagnosis, but they can help you, but you need to have chemotherapy in your doctor's office. That would fall under Part B. And let me just insert here, the Medigap plans cover hospitals and doctors. They do not cover drugs. That's totally separate, and they're not covered by your supplement. But let's say you get this diagnosis and you need $5,000 worth of chemotherapy a month, and your share is $1,000. So here's how it would work. You can buy a Medigap plan, but they are entitled to make you wait up to 6 months for a pre-existing condition. But there's one plan, the high deductible Plan F, available from Globe Life, that has that $70 premium, where you only have to wait 2 months. So it's July, you get diagnosed, you pay $1,000. You sign up for high deductible Plan F, you got to wait 2 months before you're covered for your chemotherapy. You've paid $3,000. Now what you do is you're covered and you meet your deductible of $2,300. So now after 5 months, you've paid $5,300. What I want to show you is under Medicare Advantage in this scenario, you would have paid out of pocket all the way up to $7,500. So you would still be ahead of the game. Now, I don't expect that anyone's going to take what I've said, especially without the visual presentation, and go out and implement this strategy right away. But the important thing is that I want you to know that it's there, and if enough of you are interested, ask Gemma, and I will go over this again in more detail, maybe in January or February. Because if you do have a Medicare Advantage plan, there is something called the Medicare Advantage open enrollment period, believe it or not. And what that means is between January 1st and March 31st, if you have Medicare Advantage, you can change your Medicare Advantage plan to a different Medicare Advantage plan, or you can switch out of Medicare Advantage into original Medicare, and you can choose a freestanding prescription drug plan. And because your Medicare Advantage is considered creditable coverage, you won't have any waiting period for any plan that you pick. So let's say you were faced with that $1,000 a month in your share for chemotherapy. You could switch for the next month, and you could actually buy Plan F, and you would be covered from day one. And the most you would pay would be that $3,600 in premiums. So most of us are not going to be this sick, but it's something to keep in, the back of your head. Finally, the other way you save money is on prescription drugs. And it's absolutely essential that if you want to get the lowest cost, you use Medicare.gov's Plan Finder or call 1-800-Medicare or the Medicare Rights Center. And you tell them what drugs you take, and they will come back and tell you what the lowest cost drug plan is. And what they do is they factor in a year's worth of premiums, they factor in the deductible, and they factor what you pay at the pharmacy in cash. And they give you the total cost, which is the amount of money that you pay the insurance plan and the amount of money you pay the pharmacy. Now, what happens to people is people tend to think, well, I can't tell which plan is better than the other. I'll get the most expensive plan because that must be the best. So I had someone recently who came to me, and for years, she's been on AARP United Healthcare's most expensive drug plan, which now has a monthly premium of $100. And the sad news that she found out was because she was basically healthy and took few prescription drugs, she could have been on a plan that only cost $7.20, and her drugs would have cost the same thing at the pharmacy. I've run many drugs through Medicare Plan Finder, and what you tend to find is there is no correlation between paying a higher premium and or getting a lower deductible. There's no consistent correlation that makes it worthwhile to do that. And so in many cases, even with expensive drugs, the lowest total cost, including what you pay for the drugs, is going to be from the plans with the lowest premium. And so for the many people who are on AARP regular plan F, and maybe their prescription drug plan, I've worked with many of them who have saved $1,000, $2,000 a year by switching to one of these lower cost plans. Okay, so I think that what we've got there in brief is a strategy for how you can get the best medical care at the lowest possible price. Now, there are lots of reasons you might not want to do it. You might, the dental plan might be very important. You might say, all this is too complicated for me. And you know what? That's absolutely fine, because ultimately, the insurance you choose is your personal choice. And most people are going to choose something that makes them feel comfortable and secure. My goal is not to convince you to take any one of these plans or combination of plans. It's simply to show to you how you can look at what's available and get the best possible care for the least amount of money. And so right now, does anyone have any questions?
Yes, I do. Can I ask a question?
Absolutely.
Okay, so give me 1 second. Sorry. So I remember when I was in a meeting with you. I mean, we were in a meeting in Isaac Center, and you went over the same thing that you just said. And I do have F and I have AARP, and it is expensive. But my question is, how about the supplement, the 20%? If you don't have a supplement, original Medicare will cover this one. And the second question is, the new bill that the president passed, is there a benefit for seniors? Because they did mention something.
I think you're referring to this reconciliation bill, which is still a work in progress. And originally, the more expensive version included dental care and even vision care for seniors, just like you get from the Medicare Advantage plan. From what I understand, that's been taken off the table because they don't have support from that. But there is still a possibility that the new law will enable Medicare to negotiate the price of prescription drugs, which hopefully would ultimately end in savings for consumers. Now, you were talking about the 20% and the AARP Plan F that you have. So one of the things you can do, and I've done this with people, is to actually call up AARP and say, I would like you to tell me how much you have paid my providers so far this year. And I've done this with people, and they call up and, you know, initially they said, oh, well, we don't have that information available. It's hard to get, you know, it's not on my screen. And then we said, well, we want you to get it. How long will it take you to get it? Well, it'll take a couple of days. And so they get the information back. And you might find, as in this particular case, that AARP paid your providers total $1,000, but you paid AARP total $3,600. Okay, so this is where there's an opportunity for savings. If you had no Medigap plan, instead of spending $3,600, you would have only spent $1,000. If you had the high deductible plan, you would have spent the $1,000 and an extra $800 on premiums. But you would never, under any circumstances, pay a total of more than $3,200, which is the amount of the deductible and the total premiums. In other words, it gives you a chance to save money if you're healthy.
Okay, so if you do use, well, if you're not healthy and you go a lot, this is just a scenario, and you go to the doctor a lot, and let's say people go to emergencies, and each time for the emergency is $1,200. So that's
Just
the
one
question.
moment, they're drilling outside my window, a total New York moment. I just want to close the window. Okay, I'm sorry, go ahead.
So let's say you do go to the doctor, you use the emergency, you do use it. I think I remember when we spoke about it, for the peace of mind, because you don't know what's tomorrow, people pay for this.
Okay, so in spite of what I've said, if you can afford the AARP Plan F, and it gives you peace of mind, then there's no reason why you should not have it. Because ultimately, one of the reasons you buy health insurance, and that's all this is health insurance, is to have peace of mind. So that's absolutely fine. I'm not telling you that you need to make yourself uncomfortable by switching from it. My main message is to let people know that if, because you're told if you have original Medicare, you need a Medigap plan, that it doesn't have to cost you $300 a month. But lots of people understand what I'm telling them and say, that's okay, I like it the way I have it, and I want to stick with the regular plan, and that's perfectly okay with me.
Okay.
Okay.
I have several.
Sure.
I have a question. First of all, what happens if your drugs change? Like suddenly you need different drugs.
Okay.
Rereading.
then that's the real problem. That's the limitation in everything I described. There's no way of knowing what drugs you're going to be taking next year.
Phone call to do.
Anything can pop up, and it may turn out
I don't
that
even have
had
access
you
to
known that you know, in April.
Excuse me,
you-
excuse me, sir, somebody's talking and it's hard
As
to.
of right now, I'm good, but I may need assistance with that on Friday.
Can you mute,
Just
please
to give
mute
you
your
the-
phones if you're not talking? I mean, mute your phone, okay? Okay, sorry.
Okay, so I'm sorry, the question again was, what happens if all of a sudden you have to take a prescription drug? That's the limitation of the whole system. Going to Medicare.gov, telling them the drugs you take and finding the lowest total cost plan is only good for the drugs you know you're taking now. And other than that, we're all, vulnerable. But
You can switch every year, is that
You,
correct?
you can switch every year. The main thing, though, is if you look at the arithmetic, if you have a lower premium, at least on $7.20, which is the lowest compared to $100 a month, you're going to be saving $1,000 a year that can go toward the higher expense of the drugs in the pharmacy.
Okay. Can you hear that noise in the background? It
Yes,
sounds-
and there's nothing I can do about it. It's drilling.
Yeah,
outside.
okay. Please be aware, if you're making noise, try to mute your phone. Okay,
What you're hearing is someone they're drilling in the street outside my window.
okay, fine.
So that's why I said it's
sorry.
a typical New York moment.
Right, what happens if New York can New York change its rule about letting you buy this, you know how you're allowed to buy a supplemental plan?
They could change the rule, but they would have to give you adequate notice, but there's no reason for them to change the rule, because the reason behind it is it's really the rule that's fairest to consumers.
And then those red cups.
Can you say that again, sir? It's the rule
They knew what they
I
were
don't know where
doing
you're
when
going.
they
I will
put the
check
rule in.
back office, or you can just wait.
Someone's talking in the
Doesn't
background.
come in like 5 minutes.
I
I
know.
will
Please
check
don't
another
talk
place.
in the
I just know
background
he's running
without
back and
muting
forth.
your phone.
Whoever's on this winning list.
Hey,
and this
who's
is from Monday.
talking?
Sorry, Tuesday.
Stop talking.
Okay.
Please mute your phone.
No, give it to them. If they ask
Okay,
me to store, I don't care. Whatever
Stanley
you think is
Isaacs,
best
you're
for them.
making noise.
It's someone in, it looks like the Isaacs office is muted now. Okay, so that's something we have no protection against it. Moreover, even within your own plan, on the more expensive drugs, if the manufacturer raises the cost of the drug in the middle of the year, that expense will be passed through to you in the percentage that you pay. There's nothing you can do about that. I mean, that's why this law that gives Medicare some power to negotiate the price of drugs is so important. We all read about what happened with insulin when they just started raising the prices for no good reason other than that they could get more money.
So if New York were to eliminate this ability to buy a supplemental plan, with only 2 months notice, would they have to allow you at that point to make a choice to buy a permanent supplemental plan?
Well, no, there's this one plan, the Globe Life, and you'll see on my website, and let me just turn on screen sharing so you can see that if you have Zoom. Okay. Can you see the screen sharing now?
Yes.
Okay, great. So what you're looking at here is the actual page on my website. And for those of you who have Zoom, this is valuable. So you see here websites about Medicare. Here's the site Get Help Over the Phone. And then here we come to Medicare supplements in New York. And here it says wait times for pre-existing conditions.
Okay.
Okay, here
So
we,
are you, okay.
I'm
I'm
just
not
going,
seeing it, but I see where it, I mean, I see the Medicare supplements in New York. Okay.
it's,
Is this
oh, okay,
Medicare212.com?
here we go. Okay, can you see this little chart here?
Yes.
Okay, and if you can see my cursor, it's going at Globe Life Insurance, and you'll see the pre-existing wait. And for most of them, it's 6 months, but for Globe Life, it's 2. So, what this is about is what some people might call gaming the system. In other words, instead of saluting and following the rules, we're going to look at the rules, but we're looking for ways we can save money and get a bargain. Another company that has a low wait period is Humana for their supplements. It's only 3 months. So Globe and Humana can change from 2 or 3 months to 6 months anytime they want, and they don't owe you any notice. But I don't think New York State is going to change the rules that allow you to get a Medicare plan any day of the year, and you pay the same thing as everyone else pays. I don't see that happening. And that the most they can have people wait is 6 months. I just think that's highly unlikely. And some people
And
ask,
we're talking here about the drug plan, or no, we're talking about the supplement plan.
we're talking,
Okay.
yes, here we're looking at the supplements. And I just want to show you something else here in regard to the supplements that is really important, if you will. I know this is kind of a mess, but that's what it is. So this is what you see in the Medicare handbook, Medicare and You, and you see it lists all the available Medigap plans. And you see there's a column F that's 100% for every possible item that can be covered except 80% for foreign travel, and that's the best you can get. And these plans are very confusing because how are people supposed to decide? Well, there's a website you go to, and the link's up there, where you plug in your zip code. Here it's 10025, and lo and behold, the high deductible plan F gets its own column here. You can see that in red, and it tells you what all these letter plans cost according to the insurance company you get it from. And understand, the way this works is every plan F works exactly the same. You never deal with a live person. It just takes the paperwork, processes it, and whatever Medicare says is 20%, it pays to the doctor. So here you can see for United Healthcare AARP, it's $320 a month. And for the Globe Life high deductible plan, I rounded when I told it to you, it's only $69 a month. Now, what you can't find anywhere is what I'm going to show you now, and this is how it should be. And this is why there's so much confusion over these Medigap plans. What kind of store or website do you go into where something's being sold? And this is really just health insurance that's being sold, where you see the product and the features, but you don't see the price. And you have to go to this obscure website to look up the price. So here you can see that what I have done with my handy little program here is to actually put the price from the lowest cost that you can buy each of these plans from. And so go ahead.
Where are you?
Okay. I'm at, see these red numbers? Okay, at the top. Okay, so one of the things you notice that they did in the handbook, and this is a distorted presentation. By not giving high deductible plan F and high deductible plan G its own column, you would never know about them. There's just this asterisk here. And if you look at the red arrow, you have to go way down to the bottom here. And then it says they offer a high deductible plan. And for most American consumers, as soon as you say high deductible, you know, they say, I don't want any of that. But if you look at it as buying an out-of-pocket maximum, an out-of-pocket cap, well, then if you look at the out-of-pocket cap for Medicare Advantage, that's $7,500. So how is this high deductible? A lot of what you're getting is distorted presentations that are to the advantage of the insurance companies. So what I did was to say, okay, if I go on to Amazon and I'm, looking to buy a sweatshirt or something like that, I don't know how you shop. Sometimes I want to see what's the highest rating, the best selling, but usually I say, show me what's at the lowest cost first. So if you were just enrolling in Medicare and you were presented with these choices and you actually have this chart that shows you right next to how it describes what each plan covers, how much it costs, you would say, oh, well, I'm interested in this $69 plan. But because they don't have there, the opposite happens. All you're told is that it's high deductible. So I'm giving a little sermon here because one of the reasons we're confused and we find this complicated is I can't prove that the insurance companies and the healthcare industry deliberately makes it that way, but there's a legal concept called cui bono, C-U-I, new word, B-O-N-O, and it means to whose benefit. When something weird like this has happened, when the column is not presented for the high deductible plans, like it is right here by New York State, then you say, who does this really benefit? And the answer is, it benefits the insurance companies. Whenever you have a seller and buyer relationship, it's the buyer who really understands the product. And if the consumer is confused, it's to the advantage of the seller in being able to influence you in what you can do.
Right.
I cannot emphasize this more highly, is to stand back and think and say, well, not only did I ever have any experience in choosing health insurance before I turned 65, I had no choice. My employer decided. They might give me a few choices in there, but I knew how to buy a house, a car, rent an apartment, all these big ticket purchases, but never health insurance. Then you join Medicare and you're on original Medicare and they sign you up. You never hear from them again, and you're inundated with advertising for Medicare supplements and Medicare Advantage plans. And they present things in such a way so that you will buy one or the other. United Healthcare, if you look at this chart that's up here now from New York State, and for those of you who are on the phone, you will see that United Healthcare does not offer high deductible Plan F or high deductible Plan G. Why would they? It would be against their interest. Let me go a step further while I'm on the soapbox here and go to this chart where it shows the costs above all the plans here. If AARP was really out to look for the consumer, wouldn't you think they would tell you that there is a Medicare supplement plan you can get for just $70 a month? And wouldn't they give you that on their charts? But they don't. I'm not saying they're lying to you. I'm simply saying if you look at what they actually do, they don't venture into areas that might be adverse for United Healthcare. I'm not saying it's.
Do you, okay. Yeah, this is an amazing presentation. Is there one of these companies that one of those, there were all those different high deductible plans. Which one do you think is best? Plan F.
Okay, so here's the important thing. They are all exactly the same. First of all, they're vetted by New York State, which has very strict insurance rules. I could run a Medigap plan on my laptop. The only difference between Plan F from Aetna, Bankers Conseco, Emblem, Globe Life, Humana, United Healthcare, the only real difference is in the cost, in the premium. So the best plan is the one that's the lowest cost.
Okay.
Now, you can see here in high deductible Plan F, for some reason you like Emblem or Bankers Conseco better than Globe Life. Well, it could cost you $5 more a month. So essentially they're the same. I'm just working with Globe Life because they actually have the lowest cost monthly premium for high deductible Plan F that you will find in New York State.
Your website is your website Medicare212.com?
That's it.
That's yours.
That's mine. I do this out of volunteer. I have private clients who hire me to give them a lot more attention, but my mission, I come out of marketing and advertising. My mission is to give a sucker an even break, okay? I'm not adverse to advertising and influencing consumers, but I think we all deserve to have this stuff explained to us, and it's not happening. Everyone deserves to be able to see this chart that shows you that the lowest Medicare supplement premium in New York is $70, so that all those people who say, well, I can't afford $300 for a supplement, they don't know that there's a supplement you can get for $70 or $200 for Plan L, or they don't know that you have these choices.
Are we able to change our supplement plan every year?
You can. So if you're changing from original Medicare into Medicare Advantage, you can only do that during the open enrollment period from October 15th to December 7th. If you have a freestanding prescription drug plan with original Medicare, you can only do that during that period. But if you have Medicare Advantage, you can switch to another Advantage plan between January 1st and March 31st, and you can switch back into original Medicare, and you can buy a drug plan and a supplement without any penalty or waiting period.
I should let someone else ask questions.
Well, no, but by the way, just to make the point, you see this chart?
I didn't follow that, to be honest.
Right.
If you have regular Medicare, not Advantage, and you buy one kind of plan, can you change that plan during a particular time of year every year?
you can change it any time of year. There's no restriction on when you can change it.
with the regular Medicare.
Exactly. Exactly.
Okay.
So that's for someone who, if your condition is such, I really need, let's say you're sitting here today and you think, I'm going to need to see someone at the Mayo Clinic next year, and I would need original Medicare for that, but I can't, pay those supplements. Well, what I'm saying is, fine, register for original Medicare, get your prescription drug plan now, and then see what it costs. And at any time in January, any month of the year, any day of the year, you can sign up for the supplement plan. You would just be restricted on pre-existing conditions. If you're
This is just in New York. Okay, only in New York, though.
Only in New York. And one reason it's so confusing is all the coverage and newspaper articles, magazine articles you're going to read on Medicare are for a national audience. And New York's laws are peculiar and very favorable to us as consumers and Medicare beneficiaries. So
what if you move? What happens if you move?
Well, if you move and you want to buy a supplement, then you would be subject to that state's rules. But if you buy a supplement in New York, when you move, the supplement goes with you. So it's only when you change that you would bring yourself under another state's rules.
Great.
Okay, any other questions? And I'm quite seriously, for those people, I don't know if there are any in-person presentations at the Isaac Center now, but those of you who used to come to the presentations I did, we would always have a handout. So if this were happening in action, we would have a handout. And if you email me, and my email address is jess@medicare212.com. Gemma has it. You're free to email me. It's the best way to contact me. I will send you PDFs of these charts we're looking at here. Okay, I'm more than happy to do that.
Mr. Joseph, is consultations with you very expensive or what?
Well, here's what I do. You can call me, and you can call me on the number that's on the website, the 212 number, and leave a message. Or you can email me, or you can call me on my cell phone number, in case you want to write it down. I don't put it on the website, but it's 917-575-2178. And what I do is I spend about 15 minutes and I try to understand what your problem is. And there are a lot of times when all you need is help from the Medicare Rights Center or calling 1-800-Medicare. And if you can get the help you need at no expense, I will direct you to that. And then if you feel that's not sufficient, then depending on what you need, we would discuss, the fee. And when, most people who go for this fee either just really need the assistance, or by being able to do this, they save $1,000 a year. Usually the complete package now, I charge $385 for it. So that's a big expense, but it's a lot of work for me, and I'm not trying to push it on anyone, but definitely give me a call, and in 15 minutes, I will try to send you in the direction of where you can get help at no cost to solve your problem.
Okay, thank you.
And if you want to find out just some background information to understand, I know they're not going to tell you what you told us, but just some basic stuff. Where do you recommend going?
Well, the best basic explanation of Medicare for us is the Medicare and You handbook we all get, or you can download it online. And that's it's called Medicare and You. Let me see if I can bring it up here. Okay, I'm just going to bring up a picture of it here. Hold on. Okay, there you see it on the screen. It's about 100 pages and it says Medicare and You 2022. This is written by experts in explaining these complicated things in the simplest, easiest to understand language possible. And I think by and large, they do a very good job with it. And so, you know, an interesting thing about it is you'll see a table of contents, and then you go a little bit further and you'll see an index. And that's really how to use it. Use the index, don't try to read it straight through. And then you'll be able to get that information. And if you go to my, whoops, that's not it. If you go to my web page here, let's see, where did that go? Just going to open this up. I'm going to try that again. Okay, if you go to this Medicare 212 and you see at the top here, get help. All these links are really important. I'm going to click on this link here for those of you who have Zoom. And this is where you find the price of the supplements. And what you do is you just type in your zip code, 10128. You click on search, and there it is for the current month. And part of the ridiculousness of the system is go and try this through Google. Not you would find it would be very hard to find because they keep changing the net address that they put the page on all the time. But most important, no one even knows that it's there. No one ever, I mean, you've been to Medicare presentations. No one ever says, oh, by the way, here's where you go and you can find out what the monthly premium is for every Medigap plan from every insurance company in New York.
And these are identical, like, in other words, the Aetna Plan F is identical to Mutual of Omaha's Plan F?
Right, and let me just elaborate on that a little bit. When we think of insurance, we usually think of something bad happens and a claim is made and someone decides if the claim should be covered. Original Medicare does that. They decide if the claim from the doctor, was it for a service that was medically necessary? Was it covered under Medicare? Were the right codes used? And some person is looking at that, okay? But if you look at how these Medicare supplements work, there's no human being involved. It's the doctor sends in the claim to the Medicare computer. The Medicare computer sends the payment to the doctor, and then they talk to the Medigap plan computer, and the Medigap plan computer cuts a check to the doctor. So there's no way one can be better than the other. They just, do what they do. It's like saying, is it better to pay with MasterCard or Visa or American Express? Well, they all pay, your bill. So the only difference is the price. Now, what you would ask is to say, well, look at this plan F here. Bankers Conseco charges $648 a month, and United Healthcare is only $320. By what logic does their plan cost twice as much? Because what sense does that make? You would think it must be better. I don't know why it costs more, but I think the reason they do it is they're not big in the supplement business. But let's say one of their agents has Bankers Conseco for life insurance, whatever they have, and they say, by the way, do you have a Medicare supplement? And they say, no. Well, we have that for you. And they say, how much is it? Oh, $648 a year. They have no idea what Medicare supplements cost. So that's why it's there. It's a function of marketing, I think, more than anything else. And what you'll see sometimes is, and you'll see this with the drug plans too, someone will come out and say, our drug plan is $8 a month. You say, great, you sign up. The next year, you'll get a notice saying, we've changed our monthly premium from $8 a month to $36 a month. And the reason they do that is there's no greater expense. They just sucked in a lot of people at $8, and most people don't pay attention. Those people don't even know you can change your drug plan, and they raise it to $36. Great strategy. That's how businesses work.
So drug plans are the same as the supplemental plans
No,
in terms of?
No, they're not, because drug plans do something. They negotiate prices with the manufacturers, and they keep track. They set price tiers and all that. They do something. The Medicare supplements don't do anything except pay what you owe. There's nothing to think about. Medicare says,
right,
you owe $20, they pay it. Done. So there's no, how can one plan do that better than another?
right.
That
how did you get to this? I didn't see how you got to this Medicare supplement premium page.
Oh, okay. So I'm sure. Let me go back and do that. So but I gotta lower this so I can open up a okay, so here's what I did. I went to Medicare 212, and you might see that thing with a whole bunch of dark lines. It's called the hamburger menu. You click on that. In this case, I click on Get Help, or I can go to Medicare212.com/get help. And now I put this right at the top because it's so important. Look up New York State Medicare supplement, Medicare pricing here. You click on it.
I'm not seeing any of this on the screen right now.
You don't see it?
I'm not seeing what you're doing. I see the page of the supplemental monthly premiums, but
Yes.
I'm not seeing how you got there.
I'm going to show you. So see over on the left where it says zip code? See that blue search button?
I don't know if there's something wrong. I'm not seeing anything changing on the screen right now.
Oh, because I haven't put in the zip code yet. Okay, watch. 10128.
I'm not seeing whether you're typing in a zip code.
But now do you see the chart?
I'm not, the chart Where did you put in the zip code?
It's, see where the cursor is? It's right here. It says zip code search. Let me, I'll do it once more. Okay.
I'm
You
seeing
don't
your
see-
arrow. I see your arrow. It's moving around a lot.
Okay, good. So you see this blue thing that says search?
No.
Now do you see it? Do you see
Blue
Department
thing
of
that-
Financial Services at the top?
I see that. Your arrow says is pointing on
Okay, now do you
inbox,
see the word standardized underneath that? Now go straight down to search, and to the left, there's a place for you to put in your zip code.
I see search is way down here. Your cursor is is over here.
Right,
I see search finally. Okay, but your
Okay.
cursor is not showing us at.
right.
Okay.
So to the left of that, there's a place where you put in your zip code.
Right. But
And
how did you get to this spot? How did you get here? Oh, by putting in supplement premium page or
because
something?
if you navigate here from, it's the first blue link on my website. It will be
Okay,
immediately obvious to you how you get there.
okay.
Immediately obvious. And again,
Okay.
as I say, if you want to get the Isaac Center to, get people together, I'm happy to go over this because it's quite common that, people hear me talk about this over a couple of years, and then they make the change. But it's this, what's so important about this page I'm showing you is that it has the rules for New York State. And
Okay.
what I'm describing to you when I recommend or say the default plan would be original Medicare with high deductible Plan F, that would probably not hold true in any other state. It might not be like that. That's why by paying attention to our local rules, you have an opportunity to save money by knowing what those rules are.
I'll say. Now this talk that you've just given us today, is this going to be posted somewhere?
Gemma says
It's going to be emailed out. I'm going to email the link to the recording.
Fantastic. Thank you so much.
Thank you.
Okay, so I really appreciate your attending, and again, if you want to put it together with Gemma, I'm happy to go through this again, because that's what's meaningful for me is people to have information that they really should have, and it's just not being communicated to them. And this
Thank you so much. Yes,
Thank you.
very wonderful of you.
Okay, you're all very welcome, and thank you very much for Gemma. And if I don't see you before then, I hope to see you next year for the 10th year in a row.
Okay.
Thank you.
Thank you.
Okay.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Thank you. Bye-bye.
Thank you, Gemma.